Hey, it's Dr. Oz here at the World Economic Forum in Davos, Switzerland. Wendy Buckelman asked the question, so what do you want to be remembered for the meeting? So I'm going to speak on a couple of topics here, but one big theme is personalized medicine. And let me talk about this in a very different way than you may expect. It turns out that 20% of all the drugs that we take, 20% of the treatments we give ourselves, 20% of the time when we try to lose weight, we're doing the wrong thing. Because although genetically we look similar to each other, we're not the same. We got these things called single nucleotide polymorphism, SNPs, SNPs, and they make a big difference. So some of us will take fats, for example, in our intestinal system, and we absorb them much faster. So if we eat fatty food, we gain weight. Other folks have problems with other kinds of foods. Some of the medications we give, like aspirin, such a common med, but it turns out that about a quarter of the population is resistant to the effect of this. So when you look at this at a broad level, the reality is that about a fifth of all the medications we give patients, and I'm a doctor and I give a lot of medications out, are not the right drugs for them. And if you can actually figure out how they react, for example, to a blood thinner, you can reduce complications by a huge amount. So a lot of the cancer drugs we use are for the wrong reasons, because the cancers are they have the same name, but they actually get treated differently. So it's like being colorblind. Not all of us are colorblind. If you are, you got to do things a little differently. So I'm going to give you a little quiz, a little test you can all do now. The next time you're having a meal, I want you to grab one of those small little pink packets, saccharin packets, the Sweet and Lows, and you want to take that little packet of Sweet and Low and pour it into a little bowl of water, about as much as you'd have for a tennis ball. So like, a half a cup, 2/3 of a cup. And then mix it around and then taste it. Just put a little bit in your mouth. If it tastes sweet, it means you're a hyper taster, super taster. It means you taste a lot of stuff. You actually, that's something that is it's interesting because it predicts some other problems you may have, like polyps in your colon. If it tastes bitter to you, then you're a super taster. So let me be clear again. If it's bitter, you're a super taster. If it doesn't taste that sweet, you're under taster. Under tasters eat more food to stimulate their taste buds. Super tasters don't like these bitter foods like vegetables. You eat less of them, so you get colon pops. Simple test to figure out, something you may not have thought of before, and it exemplifies how you're different from everybody else on the planet.